Hello, and welcome to the very first episode of The Nurse Doctor. My name is Dr. Sheila Ford, and I'm so happy to have you here with me on today. This podcast is going to be all for nurses, aspiring nurses, and those who desire to have just a better understanding of the nursing profession. My mission, my goal, my desire is to help educate you, empower you, and most importantly, to bring a voice to the challenges and the triumphs we face every single day in the nursing world. Before we dive into our topic on today, please allow me to share just a little bit about myself. I am a nurse, and I have been for the past 3 decades. I'm also an individual that's earned a PhD in nursing leadership, as well as I've served my country in both the U.S. Navy and the Army Nurse Corps. These credentials, I'm hoping, will just help me to impart more information into you that will give you the opportunity to empower yourself and to make great decisions. In my nursing career, I have worked in research. I've also worked in academia. Of course, I've had such a wonderful time at the bedside taking care of patients with the specialty in pediatric surgical heart. No matter where I worked, what patients I took care of, one of the most essential traits I had to have was compassion. And that's exactly what we're going to talk about on today. Compassion in nursing. I want you to think about it's extremely important to have compassion. And now take a moment and just ask yourself why. When we think about compassion, you simply can't care without being able to put yourself into a space to not only hear what your patients are going through, but to actually think about what can you do to help them. I've learned when it comes to compassion, it's basically learning how to give of yourself. The Merriam-Webster Dictionary defines compassion as sorrow or pity caused by suffering or misfortune of another, along with a desire to ease it. Every nurse should have a desire to ease the pain and suffering of their patient. As you can tell from that definition, compassion isn't just about feeling sorry for someone. It's about recognizing their pain, sometimes identifying their pain, understanding your patient's needs, and then as a nurse, you're going to take the necessary actions to assist in the best way possible. It's about being willing to put ourselves in our patient's shoes and making every attempt to make sure that we can see the world from their perspective. Now, let me ask you this. How do you define compassion in your practice? Is it the way you hold a patient's hand when they're scared? Is it how you take that extra step in communicating the details to their family member, knowing they have a loved one that's sick and in your hands? Or is it something a little bit deeper, something that goes beyond just our actions? When I think of compassion, I want to share with you one of my own personal experiences while at the bedside. One of the things that I encountered, there was an elderly woman who came into the hospital and was admitted because she was dealing with a substance abuse problem. In her 7th decade of life, this woman was dealing with a serious addiction to crack cocaine. Now, hey, I was around in the 80s. I knew what it was like to be at the bedside and to have patients coming in dealing with various types of substance abuse issues. But in the 7th decade of life, that really had me a bit concerned. So what did I do? I took the time to hear her story. And this is what she had to say. She shared with me that she had 3 beloved sons. And over a span of time, she lost every one of them to street violence. She was a lone survivor, and without having her sons in her life, her coping mechanism became crack. Now, initially, as I stated, I wanted to judge her. After hearing her story, the first thing that came to my mind, children are not supposed to die before their parents. I just could not imagine such a thing. So what did I do? I really listened. I attempted to embrace and feel where she was at this point in her life. And then I start collaborating with other departments like our case managers and our social workers. I really wanted to get her some help, but I had to get her buy-in. Now that was a challenge, but guess what? I did it. She was willing to get some counseling. She was willing to address her issues. She was even willing to learn some new coping mechanisms. Now, when I think about this story, that was compassion in action. I could have easily wrote her off, but because I heard her story, I embraced her story. I looked for ways to help her story. In this segment, we're going to explore why compassion is so crucial in patient care. Can you imagine nursing without compassion? What would that look like? What impact would it have on nursing care? What happens to patient outcomes when compassion is absent? Studies have shown that patients who are cared for are more likely to recover better. They adhere to their treatment plans and even have better mental health outcomes. But here's the thing. Compassion isn't just for our patients. It's also for us as nurses. Nursing is one of the most rewarding yet demanding professions that exist today. Without compassion for ourselves, burnout is almost inevitable. So how do we balance compassion for our patients with compassion for ourselves? What does that look like? What strategies can we use to ensure we don't run on empty? I'm sure you've heard the saying, put your oxygen mask on first before you try to assist someone else. This wisdom is crucial when balancing compassion for ourselves and compassion with our patients. You have to remember, you cannot pour from an empty cup. I remember dealing with a profound loss of my own. Within a 2-year span of time, I lost my mom, I lost my dad, and I lost my stepfather. I maintained this facade of normalcy. I was pretending everything was okay because after all, that's what we do. At the end of the day, my body started to signal that I could no longer suppress my grief. Some of the things that I had to realize was I needed time to heal. I needed time to put my own oxygen mask on. Through this experience, I learned that caring for ourselves is not only important, it's necessary. It's a prerequisite for being able to care for others. Let's talk about the real world. Because we know in nursing, things don't always go as planned. I learned every time you try to present your plan to God, He laughs at it. And basically, He lets us know that we're not in control. In nursing, compassion fatigue is real. It is not uncommon for us to take on the burdens, the stresses, and concerns of our patients. When we do this, a lot of times we take those same concerns home to our spouses, to our children, our families. When you walk in the door, sometimes it's hard to continue pressing and you've never reset. As you may know, nurses deal with compassion fatigue often as they render patient care. Therefore, it is something that we need to be addressing. As nurses, we have to hit this head on. But how do we maintain our compassion when we're stretched thin? What happens when we start to feel detached from our patients or even resentful? I strongly encourage you to recognize any feelings that you may have of being overwhelmed. I encourage you to take a step back. Trust me, it's okay to push pause. Sometimes life demands it. It's essential to implement those self-care measures that help you to reset. You might consider implementing progressive muscle relaxation exercises, or engaging in those activities that you truly enjoy. When I experience compassion fatigue, it's real simple. You're going to find me outside, walking and running. You may also find me at the beach. Sometimes I just need to sit in front of a body of water and just do nothing. I want you to consider you can't keep running on an empty tank. Prioritizing your own self-care needs is vital. I'd like to challenge you to reflect on your own experiences. Have there been times you've struggled to stay compassionate? What were the triggers? And more importantly, how did you overcome them? I find strength in prayer, meditating on scriptures, and reconnecting with the core reasons why I became a nurse. These practices tend to ground me. They allow me to regain my focus and my purpose in the midst of difficulties. Reflecting on my journey reminds me of the passion that inspired my career and renews my commitment to serve others with compassion and with care. Now that we've identified some of the challenges, let's talk solutions. What are some practical ways we can cultivate and maintain compassion in our daily practice? It might be as simple as taking a few deep breaths before entering your patient's room, or as profound as seeking out regular professional support and counseling, as previously mentioned. Here are a few strategies I found very helpful in my own practice. First, mindfulness. Knowing how to stay present, be in the moment, it helps us to connect more deeply with our patients. Peer support. Never underestimating the power of talking things through with a trusted colleague. Self-care. Yep, it's a buzzword, but it's crucial. Find what recharges you. Exercise, hobbies, or just a good night's sleep. Practicing mindfulness. It can look like something as simple as breathing exercises. Intentionally paying attention by focusing on the here and the now. Learning to just live in the moment. Peer support. That's when you find that nurse on the unit that you know their primary goal is always to help, to encourage, and to support. That's the nurse. When you need help, when you're feeling overwhelmed, you need to run in that direction. Self-care. It can be implemented by prioritizing your needs. Before we wrap up today's session, I want to leave you with just a few questions to ponder. These aren't just for reflection, but also for discussion with maybe your peers or even within your own mind. How do you personally define compassion in nursing? What role does compassion play in your day-to-day life in patient care? What are the biggest challenges that you face in maintaining compassion? How can you create a more compassionate environment for both yourself and your patients? I'd love to hear your thoughts on these questions, so feel free to reach out to me on social media or through our website. Your experiences and insights are what makes our community strong. As nurses, we are entrusted each day with the profound responsibility of making a difference in the lives of others. To truly be effective in our roles, we must prioritize self-care, nurture our compassion, and always remember the reasons that led us to this noble profession. That's it for today's episode of the Nurse Doctor Podcast. I hope you found this discussion on compassion in nursing as enlightening and empowering as I did. Remember, compassion is essential to the very heart of what we do as nurses. Don't forget to like, comment, because I really want to hear from you, share, and subscribe so you don't miss future episodes. We'll dive even deeper into the challenges and rewards of nursing. Let's spread the word about the power of compassion in nursing, reminding you to stay compassionate, stay strong, and remember, you got this. Signing out, Dr. Sheila Renee Ford, the Nurse Doctor.